What if I told you that the blood pressure pill you take every single day could be working differently depending on one simple choice you make? The time you swallow that tablet, the drink you take it with, and even the routine you follow afterward may influence whether your heart receives maximum protection or whether it remains vulnerable during the moments when your body needs support the most. Millions of adults over the age of 60 wake up every morning, drink their coffee, and take their blood pressure medication exactly as their prescription label says. Take one tablet daily. So they do. They follow the instructions faithfully because they trust that this is the safest approach. But emerging research has revealed something important that many patients have never been told. When it comes to hypertension treatment, timing matters. And it may matter far more than most people realize. Researchers following more than 19,000 patients over several years discovered that the timing of blood pressure medication could influence cardiovascular outcomes in a significant way. The findings challenged one of the most common habits in hypertension management and raised an important question: are millions of people taking their medication at the wrong time of day? There are 5 common timing mistakes that people taking blood pressure medication make regularly. Some of them seem harmless. Some may surprise you. And one mistake hidden inside your normal morning routine could be affecting your heart protection without you even knowing it. Stay with me, because understanding how your medication interacts with your body's natural rhythm may completely change the way you think about your daily routine. I'm Dr. William Lee. For more than 35 years, I have worked as an internist and cardiovascular researcher, studying the relationship between daily habits, medication effectiveness, and long-term heart health. I created this channel because important conversations about your health should not be limited to a rushed 15-minute appointment. You deserve to understand what is happening inside your own body. The study I mentioned earlier was the Hygia chronotherapy trial, one of the largest investigations into blood pressure medication timing. Researchers followed 19,084 adults diagnosed with hypertension for a median period of approximately 6 years. The participants were divided into 2 groups. One group took their blood pressure medication in the morning. The other group took it before bedtime. The results were remarkable. Those who took their medication at bedtime experienced a significantly lower risk of cardiovascular events compared with those taking their medication in the morning. The reduction was reported as approximately 45%. The findings were published in the European Heart Journal, and they created a major discussion among cardiovascular specialists because they challenged the traditional idea that morning dosing should automatically be the default approach. Before we continue, I want to ask you something. Leave your age in the comments below and tell me this. Were you instructed to take your blood pressure medication in the morning or at bedtime? And if you have ever forgotten a dose and taken extra medication later to make up for it, share that as well. You are not the only person who has done this. Many patients struggle with medication timing, and your experience may help someone else watching this video understand their own situation better. Now, let's talk about something that every person with high blood pressure needs to understand, especially after the age of 60. Your cardiovascular system does not function randomly throughout the day. Your body follows a precise biological schedule known as the circadian rhythm. This internal clock influences sleep, hormones, metabolism, body temperature, and one of the most important factors related to heart health, blood pressure. In a healthy adult, blood pressure normally decreases during sleep. This natural nighttime reduction is called nocturnal dipping. Typically, blood pressure falls by around 10 to 20% during the sleeping hours. This decrease allows the heart and blood vessels to rest. However, as morning approaches, your body begins preparing for the demands of the day ahead. Hormones increase. The nervous system becomes more active. Your heart rate begins to rise, and your blood pressure naturally increases. This phenomenon is known as the morning surge. The most significant rise usually happens between approximately 4 a.m. and 10 a.m., and this is where the timing of your medication becomes extremely important. A study published in the journal Hypertension found that this early morning increase in blood pressure is associated with a large proportion of cardiovascular events that occur during a 24-hour period. Research has linked this morning surge with a higher risk of strokes and heart attacks because the cardiovascular system is suddenly moving from a resting state into a more active state. Now add another factor: aging. After the age of 60, your arteries naturally become less flexible. The walls of your blood vessels gradually lose some of their elasticity. This means they cannot expand and adjust to pressure changes as easily as they once could. For some adults, arterial flexibility can decrease significantly over time. And when your arteries become stiffer, the sudden morning increase in blood pressure becomes more challenging for your cardiovascular system. This is why the timing of your medication is not simply about convenience, it is about matching your treatment with the rhythm of your body. The goal is to have the medication working when your cardiovascular system faces the greatest stress. But there is another mistake many people make every morning, and it involves something most people consider completely harmless: coffee. For millions of adults, coffee is part of a daily ritual. You wake up, you prepare your coffee, you take your medication, and you start your day. But if you are taking certain types of blood pressure medication, especially beta blockers, this combination may deserve closer attention. Beta blockers such as metoprolol, atenolol, and carvedilol work by affecting your body's stress response system. To understand this, imagine your sympathetic nervous system as the accelerator pedal of your body. It increases heart rate, it stimulates adrenaline release, it prepares your body for action. Caffeine can activate this system. It can temporarily increase alertness, raise heart rate, and create a short-term increase in blood pressure. Beta blockers work in the opposite direction. They slow the heart rate. They reduce the force of heart contractions. They help decrease the workload placed on your cardiovascular system. So when caffeine and a beta blocker enter your body within the same short window, two opposing signals are happening at the same time. One is pushing the system forward. The other is trying to slow it down. For many people, the medication still provides its intended effect. But for individuals who already experience irregular heart rhythms or palpitations, this interaction may become noticeable. Caffeine reaches its strongest effect approximately 30 to 60 minutes after consumption. That period can overlap with the time when your medication is beginning to work. Some patients may feel fluttering sensations, skipped beats, or an uncomfortable awareness of their heartbeat. A cardiovascular research team tracking patients using beta blockers found that individuals consuming multiple cups of coffee shortly after taking their medication reported more frequent episodes of symptomatic palpitations compared with those who separated their coffee and medication routine. One patient I worked with was Margaret, a 68-year-old retired teacher from Louisiana. She had been taking metoprolol for several years and began experiencing a strange fluttering feeling in her chest almost every morning around 9 a.m. She assumed it was anxiety. But when we carefully reviewed her daily routine, we discovered something important. She drank coffee around 7:30 in the morning and took her medication shortly afterward. We changed only the timing. She moved her medication earlier and waited before drinking her coffee. Within a few weeks, the uncomfortable sensations disappeared. She later told me something that many patients say after discovering these simple connections. Why did nobody ever ask me what time I drink my coffee? And that is exactly the point. Sometimes the smallest details in your daily routine can influence how your medication interacts with your body. If you take a beta blocker, consider creating some space between your medication and your first cup of coffee. A practical approach is to separate them by at least 45 minutes unless your healthcare provider has given you different instructions. Taking your medication with a full glass of water can also help create a consistent routine and support proper absorption. And remember, small adjustments should always be discussed with your doctor, especially if you have existing heart conditions, because your medication is not just a pill, It is part of a larger system involving your body, your habits, and your daily rhythm. Another area where many patients unknowingly create problems with their blood pressure medication involves something that appears completely natural and healthy: fruit juice, especially grapefruit juice. Many people have heard that grapefruit can interact with certain medications, but the majority do not realize how long that interaction can last or how significant the effect can become. I have spoken with many patients who tell me, "Yes, I know grapefruit can interfere with medication." Then I ask them a simple question: when was the last time you had grapefruit or grapefruit juice? Many respond, "A few days ago." And that answer reveals the problem. Because this is not always an interaction that happens only at the exact moment you swallow your medication. The effects can continue for much longer than people expect. Grapefruit and grapefruit juice contain natural compounds called furanocoumarins. To understand why this matters, imagine your digestive system has a quality control checkpoint. Inside that checkpoint is an important enzyme called CYP3A4. This enzyme helps process many medications and controls how much of the drug enters your bloodstream. It acts like a regulator, making sure the medication reaches the proper level. But grapefruit compounds can interfere with this system. They can temporarily reduce the activity of CYP3A4, sometimes for up to 72 hours after consumption. When this enzyme is affected, certain medications may not be broken down in the normal way. As a result, the amount of medication circulating in your bloodstream can become higher than intended. For people taking calcium channel blockers, this interaction can be especially important. Medications such as felodipine, nifedipine, and amlodipine work by relaxing blood vessel walls. They help reduce resistance inside the arteries, allowing blood to flow more easily and helping lower blood pressure. But if the concentration of these medications rises too much, the blood pressure reduction can become excessive. Instead of creating a controlled lowering effect, the body may experience an exaggerated response. This can lead to dizziness, lightheadedness, weakness, and in some older adults, even dangerous fainting episodes. This risk becomes greater as we age because the body's ability to quickly adjust blood pressure changes may become reduced. A younger person may stand up quickly and compensate immediately, but an older adult with naturally stiffer arteries and reduced vascular flexibility may struggle to maintain enough blood flow to the brain. Researchers studying this interaction found that patients consuming grapefruit products while taking certain calcium channel blockers experienced a higher rate of episodes involving dangerously low blood pressure compared with those who avoided grapefruit. One patient who experienced this problem was Robert, a 72-year-old retired electrician from Arizona. Robert had been taking amlodipine for several years. His blood pressure was stable. He had no major problems. Then, his wife purchased a new type of citrus juice. It seemed like a healthy choice. But what they did not realize was that the juice contained grapefruit. Robert did not check the ingredient label. Within a few days, he suddenly became dizzy while standing up from the breakfast table and collapsed. Fortunately, there was no heart attack. There was no stroke. But when his blood pressure was measured, it was dangerously low. His reading was 86/52. After reviewing everything carefully, we discovered the cause. The medication itself was not the problem. The grapefruit interaction had changed how his body processed the medication. This is why understanding your medication is just as important as taking it. If you are prescribed a calcium channel blocker, ask your doctor or pharmacist a very specific question. Does grapefruit interact with my exact medication? Do not assume that every medication works the same way. Do not rely only on general information. The details matter. For many patients taking calcium channel blockers, avoiding grapefruit products completely is the safest approach unless their healthcare provider says otherwise. There are many other options you can choose instead. Water, apple juice, or other fruits that do not create the same interaction risk. Another helpful habit is supporting your cardiovascular system through nutrition. Foods rich in magnesium, such as spinach, almonds, and other nutrient-dense choices, can support healthy blood vessel function. However, always remember that supplements and major dietary changes should be discussed with your healthcare provider, especially if you take multiple medications. Now we arrive at the third medication timing mistake. And this one is interesting because at first glance, it does not seem connected to heart health at all. It appears to be a simple inconvenience, a sleep problem, a nighttime bathroom trip, something many older adults assume is just part of getting older. But sometimes what looks like a normal aging issue is actually a preventable medication timing problem. The medication involved is a diuretic. Many people know these medications by another name: water pills. Diuretics are among the most commonly prescribed medications for controlling high blood pressure. Examples include hydrochlorothiazide, furosemide, and chlorthalidone. Their purpose is straightforward. They help the kidneys remove extra fluid from the body. Think about your blood vessels, like a system of pipes. If there is too much fluid inside those pipes, pressure increases. By helping your body remove excess fluid, diuretics reduce the amount of pressure placed on the cardiovascular system. They are extremely valuable medications, but timing matters. The problem occurs when people take these medications too late in the day. Sometimes this happens because they forget their morning dose. Sometimes nobody explains the best timing, so they take their water pill with dinner, or even before going to bed. The medication then begins working during the hours when they are supposed to be sleeping. The kidneys increase urine production. The bladder fills. And suddenly, at 1 a.m., 2 a.m., or 3 a.m., the person wakes up and has to get out of bed. Now consider what happens inside the body during that moment. You have been lying down for several hours. Your blood pressure has naturally changed during sleep. Then you stand up quickly in the darkness. Your blood vessels need to tighten immediately to maintain blood flow to your brain. But in many older adults, that response is slower. This condition is called orthostatic hypotension. It occurs when blood pressure drops significantly after standing, and it becomes increasingly common with age. For adults over 70, this problem can affect a significant percentage of the population. The danger is not just feeling dizzy. The real danger is falling. A fall in the middle of the night can change someone's life permanently. The National Institute on Aging has highlighted nighttime falls as one of the major causes of serious injury among older adults, and hip fractures are especially concerning. For people over the age of 70, a hip fracture is not simply a broken bone. It can begin a chain reaction involving reduced mobility, loss of independence, complications from hospitalization, and increased health risks. This is why medication timing is not a small detail. A simple adjustment can sometimes prevent a serious event. Researchers examining patients using diuretic therapy found that those who took their medication later in the afternoon had a higher risk of nighttime falls requiring medical attention compared with those who took their medication earlier in the day. One patient I worked with was Patricia, a 74-year-old retired librarian from Ohio. For more than a year, Patricia had been waking up several times every night. She assumed this was simply something that happened with aging. She was taking hydrochlorothiazide, but she had never been given clear instructions about timing. She was taking it with her evening meal around 6:30 p.m. After reviewing her routine, we changed the timing. She began taking the medication in the morning instead. The result was remarkable. Within 1 week, her sleep improved dramatically. She called the office and said something that stayed with me. "I feel like I got my life back." And this is exactly why these conversations matter. The goal is not just to lower a number on a blood pressure monitor. The goal is to help you live your life with confidence, stability, and independence. For most people taking diuretics, the general recommendation is to take them earlier in the day. Many patients benefit from taking them before late morning. If you take a twice-daily diuretic, the second dose is usually better earlier in the afternoon rather than near bedtime. However, your exact schedule should always be confirmed with your healthcare provider because medications and health conditions are different for every individual. A simple habit can also make a difference. Because some diuretics can influence electrolyte balance, including potassium levels, maintaining a balanced diet with potassium-containing foods may support healthy heart function. Foods such as bananas or plain yogurt can be part of a healthy routine for many people, but again, your personal medical situation matters. If you have kidney disease or take other medications that affect potassium, your doctor should guide those choices. The larger lesson is this: your medication does not work in isolation. It works together with your body's natural rhythms, your daily habits, your food choices, and your lifestyle. The more you understand those connections, the better prepared you become to protect your heart. And we are only halfway through. The next mistakes involve two habits that many people make without realizing the potential consequences. One involves what happens when you forget a dose. And the other involves the biggest misunderstanding of all: taking your medication at a time when your body may not actually need the strongest protection. Now we come to another mistake that almost every healthcare professional has heard from a patient at some point. You forget your medication. Maybe your morning becomes unusually busy. Maybe you travel. Maybe you simply lose track of time. Then suddenly, hours later, you look at the clock and realize something important. You missed your blood pressure pill. At that moment, many people have the same thought: I'll just take 2 doses tonight and catch up. It seems logical. You missed one, so you replace one. But when it comes to blood pressure medication, this simple decision can sometimes create a much bigger problem than the missed dose itself. The reason is that your body does not respond to medication like a simple mathematical equation. Taking twice the amount does not always create twice the benefit. Sometimes it creates an unsafe drop in blood pressure. To understand why, imagine your arteries as a network of flexible pathways carrying blood throughout your body. Your blood pressure medications work by carefully adjusting the pressure inside that system. Some medications relax the muscular walls of your arteries. Others reduce the signals that cause blood vessels to tighten. Others influence fluid balance. Each medication has been designed to create a controlled effect over a specific period of time. When you take the correct dose, your body receives a gradual and predictable response. But when you suddenly take an additional dose, especially with certain long-acting medications, the effect can become too strong. This is particularly important with medications such as calcium channel blockers and long-acting ARBs. These medications are designed to provide steady protection throughout the day. They are not designed to be used as a catch-up treatment. Taking an extra dose can cause blood pressure to fall too quickly. And when blood pressure drops suddenly, your brain and heart may not receive the blood flow they need. In a younger person with flexible arteries and a strong cardiovascular response system, the body may compensate more effectively. But in adults over 65, the situation can be different. Many older adults have some degree of reduced vascular flexibility. Some may have underlying coronary artery disease. Some may already have difficulty maintaining stable blood pressure when changing positions. A sudden drop can result in dizziness, loss of balance, fainting, a condition called syncope, and in certain cases, reduced blood supply to vital organs. This is why taking extra medication without guidance is not a harmless solution. It can turn a small mistake into a medical emergency. Researchers studying medication adherence patterns among people with hypertension found that patients who experienced episodes of doubling their medication after missed doses had a significantly higher risk of emergency blood pressure events compared with patients who maintained a consistent routine. Another problem is quieter but equally important. Some patients are prescribed medication twice a day. At first, they follow the instructions, but over time, taking a pill in the morning and another later in the day becomes inconvenient. So they begin making their own adjustment. They take only 1 dose. They think, my blood pressure numbers look okay, so maybe 1 pill is enough. But what they may not realize is that the medication was designed to provide continuous protection. The doctor did not prescribe two doses randomly. The schedule was created because the body needs support throughout the entire day. When someone takes a twice-daily medication only once daily, they may create periods where the medication level becomes too low. The blood pressure reading during a clinic visit may look acceptable, but that does not always show the complete picture. Blood pressure changes throughout the day. It responds to stress, physical activity, sleep, hormones, and daily routines. A medication schedule that is only partially followed may leave gaps in protection during the hours when the body needs it. Researchers following thousands of patients with hypertension discovered that inconsistent medication use was associated with higher rates of cardiovascular complications compared with patients who followed their prescribed schedule consistently. One patient who experienced this problem was Dennis, a 66-year-old contractor from Colorado. Dennis had been taking amlodipine and valsartan for several years. His work schedule was unpredictable. Some mornings started early. Other days began much later. Eventually, he developed a habit. Whenever he remembered that he had missed his morning dose, he would take 2 pills in the evening. He believed he was correcting the mistake. But his body was experiencing something very different. One evening, after taking an extra dose, Dennis became extremely weak. His wife found him unconscious on the kitchen floor. When emergency responders checked his blood pressure, it was dangerously low. The problem was not a heart attack. It was not a stroke. It was a preventable medication timing mistake. This story is important because many people believe medication safety is only about taking the right medicine. But it is also about taking the right amount at the right time. So what should you do if you miss a dose? The safest answer is not to guess. Do not automatically double your medication. Do not assume that every blood pressure pill follows the same rule. Different medications behave differently inside the body. If you remember a missed dose later the same day, many medications can be taken when remembered, as long as the next scheduled dose is not approaching. But if it is close to your next dose, the missed dose is often skipped. The exact instructions depend on the medication you take. That is why your pharmacist can be one of your most valuable resources. A simple phone call can prevent a dangerous mistake. Another helpful strategy is creating a medication habit connected to something you already do every day. For example, taking your pill after brushing your teeth. Taking it with your first meal. Using a daily reminder on your phone. Research on medication adherence has shown that connecting medication with an established routine can significantly reduce missed doses. The goal is not to rely on memory alone. The goal is to build a system that makes taking your medication easier, because consistency is one of the most powerful tools you have. And now we reach the mistake that may be the most important one in this entire discussion. This is not about grapefruit. It is not about coffee. It is not about forgetting a pill. This is about something much deeper. It is about understanding the relationship between your medication and your body's internal clock. For decades, the standard instruction for many blood pressure medications has been simple. Take once daily in the morning. For generations of patients, that became the routine. Wake up. Take your medication. Start the day. But modern research into circadian biology has forced scientists and physicians to ask an important question. What if the traditional timing is not always matching the body's greatest need? Your blood pressure does not remain constant from morning until night. It follows a rhythm. During sleep, it usually decreases. As morning approaches, it rises. The nervous system becomes more active. Stress hormones increase. The body prepares for movement and activity. This is a normal biological process. But for people with hypertension, especially older adults, this morning increase can become a vulnerable period. The cardiovascular system suddenly experiences a higher workload. The heart begins pumping against greater resistance. The arteries experience increased pressure. And this is exactly the time when many cardiovascular events occur. Now consider the timing of a typical morning medication dose. Many people take their pill around 7 or 8 a.m. The medication then needs time to travel through the digestive system, enter the bloodstream, and reach effective levels. By the time the medication reaches its strongest activity, the morning blood pressure surge may already be decreasing. Then, as the next early morning arrives, medication levels may have declined. The body enters its most challenging period again. This raises a fascinating possibility. What if medication timing could be adjusted to provide stronger protection exactly when the body is most vulnerable? This concept is called chronotherapy. It means aligning treatment with the body's natural biological rhythms. And this idea has changed the way researchers think about hypertension management. One major study investigated whether taking blood pressure medication at bedtime could provide stronger cardiovascular protection compared with morning dosing. The results created significant discussion in the medical community. Patients who took medication at night showed improved nighttime blood pressure patterns and reduced cardiovascular risk in that study. However, as with all medical research, the full picture requires careful interpretation. Different studies have produced different findings. Some researchers have questioned certain aspects of the original trial. Other large studies have not found the same level of benefit. And this is an important point. Good medicine is not about following a single study without question. It is about looking at the total evidence and understanding how it applies to each individual patient. The science continues to develop, but one thing has become increasingly clear. Blood pressure patterns are personal. Some people experience abnormal nighttime blood pressure. Some people do not. Some patients may benefit from different medication timing. Others may not. The most important step is not changing your medication schedule on your own. The most important step is understanding your own blood pressure pattern. And that is where a powerful tool called ambulatory blood pressure monitoring becomes valuable. This test measures your blood pressure throughout a full 24-hour period. It shows what happens while you are awake, what happens while you sleep, and whether your blood pressure follows a healthy rhythm or shows patterns that require attention. Because the best treatment plan is not based only on a single number taken in a doctor's office. It is based on understanding your body throughout the entire day. When we talk about blood pressure treatment, one of the biggest mistakes we can make is assuming that every patient's body follows the exact same schedule. Medicine has advanced tremendously because we have learned that the human body is not just a collection of organs working independently. It is a living system controlled by rhythms, signals, hormones, and patterns that change throughout the day. Your blood pressure is one of those patterns. The goal of treatment is not simply to lower a number. The goal is to protect your heart, your brain, and your blood vessels during the moments when they face the greatest stress. This is why the conversation about medication timing is so important. For some patients, taking medication in the morning may be completely appropriate. For others, especially those whose blood pressure remains elevated at night or rises sharply in the early morning hours, a different schedule may provide better protection. The question is not, what time does everyone need to take their medication? The better question is, what time does your body need the medication the most? That is the foundation of personalized medicine, and it is one of the most important changes happening in healthcare today. For many years, doctors relied heavily on measurements taken during office visits. A patient would arrive. A blood pressure cuff would be placed on the arm. A number would appear on the screen, and that number would guide treatment decisions. But the body does not live inside a clinic. Your blood pressure changes when you sleep. It changes when you exercise. It changes when you experience stress. It changes when you wake up and begin moving through your day. A single measurement provides only one moment in time. It does not always reveal the complete story. This is why a 24-hour ambulatory blood pressure monitor can be so valuable. The device measures blood pressure at regular intervals throughout the day and night. It allows doctors to see patterns that would otherwise remain hidden. Some patients discover that their blood pressure drops normally during sleep. This is called a dipping pattern. Others may discover that their blood pressure does not decrease enough overnight. This is known as a non-dipping pattern. And this difference matters. Patients who do not experience the expected nighttime decrease may have a different cardiovascular risk profile and may require a more personalized approach. The information from this type of monitoring can help doctors decide whether medication timing should be adjusted. But the important message is this: never change your blood pressure medication schedule without discussing it with your healthcare provider. A medication that works well for one person may not be the right choice for another. Your age, your kidney function, your other medications, your heart health, your daily routine, all of these factors influence the safest approach. The most successful patients are not simply the ones who take medication. They are the ones who understand why they take it. Because when you understand the purpose behind your treatment, you become an active participant in your own health. And that partnership between patient and physician is where the best outcomes happen. Now, let's return to one of the most common questions I hear from patients. If my blood pressure numbers look good, does timing really matter? This is an excellent question, and the answer requires understanding the difference between control and protection. A person can have a good blood pressure reading at a doctor's appointment and still experience dangerous changes at other times of the day. For example, someone may have a normal reading at 10 a.m. in the clinic, but their blood pressure may rise significantly at 5 a.m. every morning before they wake up. Without additional monitoring, that pattern may remain invisible. This is why doctors sometimes describe patients as being controlled on paper. The number looks acceptable, but the full picture has not yet been discovered. The purpose of modern cardiovascular care is to move beyond simple measurements and understand the complete behavior of the body. That includes medication timing, diet, physical activity, sleep quality, stress management, and the many daily choices that influence cardiovascular health. Your medication is a powerful tool, but it works best when it is aligned with your biology. Think of it like planting a seed. The seed contains potential, but the environment determines how well it grows. Medication is similar. The medication itself matters, but the timing, consistency, and circumstances around it influence how effectively it performs. This is why small adjustments can sometimes create meaningful improvements. A patient who separates coffee from certain medications, a patient who avoids grapefruit interactions, a patient who takes a diuretic earlier in the day, a patient who stops doubling doses after missed medication. These are not complicated medical procedures. They are simple changes based on understanding how the body works, and sometimes the simplest changes create the greatest improvements. There is another important factor we need to discuss. Many people assume that because they have been taking the same medication for years, there is nothing new to learn. They think, I have been taking this pill for 10 years. I know everything about it. But medicine continues to evolve. Research continues to reveal new information, and your own body continues to change as you age. The medication that was perfect for you at 55 may need to be reviewed at 70. Not because something is wrong, but because your body is different. Your arteries may have changed. Your kidney function may have changed. Your activity level may have changed. Your sleep pattern may have changed. Good healthcare requires regular conversations. It requires asking questions. And it requires patients feeling comfortable saying, can we review whether this is still the best approach for me? That one question can open the door to better care. So at your next appointment, consider bringing a few specific questions with you. Ask, is my blood pressure pattern changing throughout the day? Would a 24-hour blood pressure monitor give us more information? Does my medication timing match my personal blood pressure pattern? Are there foods, drinks, or supplements that could interfere with my medication? These questions transform an ordinary appointment into a more meaningful health conversation. Because your health is not just about receiving instructions, it is about understanding decisions. And when it comes to protecting your heart, knowledge is one of the most powerful tools available. Now, there is one final part of this conversation that I want to emphasize. It is something deeper than medication schedules and research studies. It is about the way we think about aging and health. Many people believe that getting older means accepting decline without question. They believe that feeling tired, experiencing changes, or managing health conditions means they have lost control. But that is not the complete story. Aging is a natural biological process. Some changes are unavoidable. But many aspects of health are influenced by the choices we make and the knowledge we gain. The morning blood pressure surge, the interaction between food and medication, the importance of consistent timing. These are not things you simply have to accept. They are factors you can understand, and what you understand, you can often manage. Modern medicine has given us extraordinary tools. Blood pressure medications have prevented countless strokes, heart attacks, and complications. They have allowed millions of people to live longer, healthier lives. Taking medication is not a sign of weakness. It is not a failure. It is an example of using science to support your body. The key is learning how to use that tool correctly. Because a medication is not just a chemical substance. It is part of a larger strategy designed to protect your future. There is one final message I want to leave you with today. Not as your physician. Not as someone explaining research papers or discussing clinical studies. But simply as one person speaking to another. Every person watching this video is carrying something. For some, it is a prescription that has become part of everyday life. For others, it is the quiet concern that comes every time they check their blood pressure. And for many, it is the realization that the body they have today does not always respond the way it did 20 or 30 years ago. That is completely understandable. But here is what I hope you never forget. Modern medicine has accomplished something extraordinary. The ability to lower the risk of heart attack, stroke, heart failure, and other cardiovascular complications through carefully designed medications is one of the greatest achievements in preventive healthcare. These medications have helped millions of people live longer, remain independent, and enjoy more years with the people they love. Taking blood pressure medication is not a sign that your body has failed. It is simply one tool among many that helps protect one of the most important organs you have. And like every tool, its effectiveness depends on how it is used. Today we discussed 5 common mistakes that many people make without realizing their potential consequences. We talked about how your body's biological clock influences blood pressure throughout the day. We explored why the early morning hours place greater stress on the cardiovascular system. We looked at how something as ordinary as a cup of coffee may affect certain beta blockers when taken too close together. We examined why grapefruit can interfere with calcium channel blockers long after it has been consumed. We discussed why taking a water pill late in the day may increase nighttime bathroom trips and raise the risk of dangerous falls. We explained why doubling a missed dose is never a decision that should be made without professional guidance. And finally, we explored the growing scientific discussions surrounding medication timing and why individualized treatment based on your body's natural blood pressure pattern may become an increasingly important part of future cardiovascular care. Notice something about all 5 of these topics. None of them required an expensive procedure. None of them involved complicated technology. None depended on miracle supplements or unrealistic promises. They were based on understanding. Understanding how medications work. Understanding how your body changes with age. Understanding that small daily habits can influence long-term health. Knowledge is often one of the most powerful forms of prevention. Every informed decision you make today may reduce the risk of a serious event years from now. That is why I encourage every patient to remain curious. Ask questions. Review your medications regularly. Read the labels. Talk openly with your physician and pharmacist. If something is unclear, ask again. Healthcare works best when patients become active participants rather than passive observers. One conversation can change a treatment plan. One question can uncover an interaction that has gone unnoticed for years. One adjustment in timing may improve blood pressure control more than adding another medication. And sometimes the simplest change can produce the greatest improvement in quality of life. If today's discussion has taught us anything, it is that managing blood pressure is about much more than swallowing a pill. It involves your sleep, your meals, your hydration, your daily routine, your physical activity, your nutrition, your stress levels, and the consistency with which you follow your treatment plan. All of these pieces work together. Think of your cardiovascular system as an orchestra. Each instrument has its own role. Your heart, your arteries, your kidneys, your nervous system, your hormones, your medications. When every part works together in harmony, the result is balance. But when one element falls out of rhythm, the entire performance can be affected. Your goal is not perfection. Your goal is consistency. Small improvements repeated every day often produce remarkable results over months and years. That is how preventive medicine works. It protects your future one decision at a time. Before you make any changes to your medication schedule, remember one important principle. Always speak with your healthcare provider first. Research continues to evolve, and treatment should always be tailored to your own medical history, other medications, kidney function, heart health, and overall condition. There is no single schedule that is right for everyone. The best treatment plan is the one designed specifically for you. If your doctor believes it is appropriate, ask whether a 24-hour ambulatory blood pressure monitor could provide a clearer picture of your blood pressure pattern throughout the day and night. That information may help determine whether your current medication timing is giving you the protection your body truly needs. Sometimes the most valuable prescription is not a new medication. It is a better understanding of the one you are already taking. As we finish today, I want you to remember something that I have learned after decades of caring for patients. Healthy aging is not about avoiding every illness. It is about giving your body the best possible support with the knowledge available today. Every year, medical science learns something new. Every year, researchers improve our understanding of how the body works. And every year, patients who stay informed place themselves in a stronger position to make better decisions about their health. That is exactly why this channel exists. To translate complex medical research into practical information that helps you protect your heart, preserve your independence, and make confident decisions about your well-being. If this video helped you understand something that was never fully explained during a clinic visit, I hope you will continue learning with us. Every week, we explore peer-reviewed research, practical health strategies, and evidence-based guidance designed specifically for adults over 60 who want to stay healthy, active, and informed. Now I'd love to hear from you. Which of these 5 medication timing mistakes surprised you the most? Was it the interaction with coffee? The hidden risk of grapefruit? The timing of water pills? The danger of doubling a missed dose? Or the research on bedtime versus morning dosing? Share your answer in the comments below. And while you're there, tell us your age. Your experience may help another viewer recognize a habit they should discuss with their own doctor. Thank you for spending this time with me. Take good care of yourself. Stay curious. Keep asking questions. And never underestimate the value of understanding your own health. I'm Dr. William Lee. After more than 3 decades in medicine, I still believe the most important conversations about health are the ones that empower people to make informed decisions long before an emergency ever happens. And that is exactly the conversation we should all be having.